oh, thank you, to come and just share out what's been happening in LWIA 7 around making a recommendation for a referral system. So pretty excited to have that conversation and get your feedback on it. And then we'll be looking for people to join the policy writing subgroup. And that's what we're going to talk about today. Okay. So all names visible on the Zoom will be called, and Sarah will take over the roll call from here.
Okay, perfect. And I just want to make sure there's new people in the room, and I apologize ahead of time if I do not get your name correctly, but if I don't, you can chime in and correct me. So I'm just going to read the names on the Zoom participant list, and if you don't hear your name, you can go ahead and unmute and let us know that you're here. So Becky Raymond, Sarah Goldhammer, Marissa Lewis, Kathy Tracy, Drew Thomason, Molly Cook, Nadia Mejay, is that right?
Nadia Mejia.
Okay, Stacy Cragall, Emma Malahut Batel. I'm so sorry.
It's okay. It's so okay. Maya Butel.
Okay, perfect. Justin Arnold, Tara Driver, Courtney Greiger, Janice Taylor Brown, Megan McGinty, Todd Lowry, Brian Richard, Laura Dom, Natasha Telger. I'm just going to make sure that that's everyone. And again, if you didn't hear your name mentioned, you can go ahead and unmute, and we'll make sure that you're accounted for on the minutes. Good.
Okay. Just to revisit our community agreements, we are keeping customers central to the discussion. We're taking and making space so that everyone can have balanced contributions. We're trying to avoid jargon to the best of our ability. There's no such thing as a silly question, and together we know a lot, just to keep rooted in these as our community agreements. And because people are in so many working groups, what are the priorities of this work group? It's to integrate service delivery, to improve access and opportunity. It's to promote cross-agency collaboration and alignment, and to review the 2019 self-assessment process. So just again, to make sure that everyone's on board, that our ultimate goal is to revise the current service integration policy and present it to the IWIB by July 2023. And so in the November meeting, we reviewed the one-stop operator focus group questions. Carrie shared research that she had been doing on the MOU process, and the work group discussed the plan and goals for the scope. And so because the service integration policy is so broad, several of the areas will be also coordinated with other work groups around staff goals, career pathway goals, information, and evaluation. And so since we last met in November, Sarah and Molly have been looking at the local plans and have started compiling and categorizing some of the content that's relative to service integration. We had 3 one-stop operator focus groups that I'm excited to share out about, and we're starting to really identify the themes from the one-stop operator focus group, which we'll get into now. Oh, wait, one last thing before. And then, so today we're reporting out about the research from the focus groups. We're establishing the policy writing subgroup. And this referral discussion is a new point on our work plan. We were asked by a couple of the partners to present on the work that we've been doing in LWIA 7 and the focus groups. Also, there are other areas that are also have really interesting things to share, but we're going to start with the work we've been doing in LWIA 7 and start the conversation from there. So sound good? Does anybody have any questions? I feel like I'm just rushing through the deck here. Anything? No? Okay. All right. So
Okay.
Sarah
Sorry.
will take this one. Yeah, go ahead. Sorry.
So during December, Molly Cook and I, my colleague at ICSPS, reviewed 18 local plans, specifically Chapter 4, which entailed the 2022 modifications. And we made sure to pull local plans representing each area of the state. We didn't have time yet to delve into more findings, but our initial findings so far are they do lack consistency in formatting. There are many useful examples within the plans, and they all noted different plan modifications structurally based on COVID-19 impacts. We did also come across a question internally is how can we make this local planning process more useful to the entire system? And that's one that I know this group will end up getting to. The next steps within the local plan research is to continue to compare them to focus group statements, to analyze themes and commonalities across the local plans and regions, to highlight promising practices from these local plans and identify noted struggles and barriers. So that's just kind of where we're at in the research. And now we'll kick it back over to Becky for the focus groups.
Okay, thank you. Sarah, so yeah, we did 3 focus groups in December. We had 15 participants. 7 were in the central part of the state, 8 were in the northern. We also were really thinking through what the model was for one-stop operator. 11 were part of a consortium model represented by Title I predominantly, and 1 represented by Title III, and the remainder were single entity representatives. So just thinking through how the model of the one-stop operator, might have an impact in response to some of these questions that we asked.
So I have a clarifying question, please.
Sure.
You had 15 participants. Am I interpreting this correctly, that the participants were either from Title I or Title III?
Unless it was a single entity.
So did you have any Title II or Title IV individuals in these spaces? Is that who the single entity representatives are? As we're looking at service integration, it's important to have the voices of all the partners at the table. And I see a large grouping of Title I and Title III, mostly Title I. But I guess I'm really not seeing Title II and Title IV with a strong representation in this. So I'm just a little concerned that if we're talking about service integration across the state, that I think all of the titles should be part of it. And we talked about that last time, that all titles should be equally represented. And I'm missing this, or I'm not seeing it, but I'm seeing it very heavily influenced by Title I. Is that kind of the direction we needed to go? Or is that because that's who was available? Or, excuse me.
We did hear from 1 Title II consortium member, but I think that is part of the issue, is that Title II or Title I, even in the consortium models, is like, I don't know, that's who responded to our request to attend. I mean, let's see, Justin, are you responding to Kathy, or do you have something?
No, that's I'm not responding to something else. I'm responding to Kathy, which is, this is typical of the work that gets done in local workforce areas every day, which is Title I is responsive and at the table and it's hard to get other people at the table. So we've asked, like even in our area, and I know other areas did too, Title II, Title III, Title IV, do you want to show up? This is important. A month, 2 months. Hey, this is going on. We're going to have these meetings. Please show up. We want to engage you. And then just don't show up. And that happens throughout Illinois is for whatever reason, 2, 3, and 4 aren't as
Well,
responsive as Title I.
I think I would respectfully disagree that the titles aren't equally as concerned about this workspace. There might be, because as I hear from my Title II partners, where they often feel excluded from these conversations. So I hear what you're saying, and I don't think it's a Title I, Title II issue. I think it's how we communicate with these groups as expectations. Because I know they're all doing hard work. So I guess the challenge, and I'll let it go here, but I do think that we cannot get to a point of service integration and policy without voices from all partners, without everybody at the table, so that we can deal and address the concerns that Justin is sharing, saying, hey, this is what we're trying to do, and we're not seeing that partnership. Well, then what is the messaging that I have to give to my programs as Title II? What does that messaging look like? How do I support this work to make them informed if that is the actual barrier? I guess, and I know we talked about this last time, so I don't want to belabor it, but I don't know how we can look at the outcome of this as anything that's going to lead to service integration when 3 of the 4 partners were not actively engaged in this process. So
Yeah, so I mean, I just want to say that like we had to cobble together a list. Like there was not even a list of one-stop operators readily available. So then once we've got together a list of who's doing one-stop operation, and we just pulled it together thinking through who we knew, we sent it out. And so like, yes, I think we could dig deeper, and I would love your support in getting Title II. I mean, I feel very strongly about Title II's role in this, and then the reality of how deep we can work to engage partners beyond an email when it took us a while to like get contact information. So just like I see this focus group process as really building up the ability to even talk to one-stop operators comprehensive. So that's also in response to Courtney's question about how were the individuals invited. So we pulled together the list to the best of our ability, and yeah, I would like to see, even more engagement. I think like, maybe some of them didn't know us, so they were reluctant, or, I think that this stuff is going to build with time, but that's kind of what we were starting from. Laura?
Hi, I just wanted to address that the one-stop operator policy requires that each of the local areas procure the one-stop operator. And so they do put out a request for proposal, and those that are consortium models are supposed to provide a plan that shows how each of the partners within the consortium model are to work towards doing the goals of the one-stop operator. A lot of times they should separate out Title I will do this, Title II will do this, Title III will do X, Y, Z, and so on and so forth. And so then there's also, once they provide that, and there is a contract written with the board and the one-stop operator, if there's not anything in question, or they can even go further and define those roles in the one-stop operator agreement contract. And so perhaps that is a good thing that we could look at to say that, maybe this is not come to fruition as much as it should be. Maybe these roles and responsibilities are not laid out well enough. Maybe people aren't aware of what their roles and responsibilities are. So I definitely think that there is more than enough room for for us to get where we need to be for service integration, I think we just need to have everyone in the room and say, hey, you know, expectations need to be set forth, and everyone needs to be aware of those expectations before we can move forward. And that's all I wanted to add.
Thanks, Laura. Janice? Hi, Janice.
Hi. So I did want to say, when these type of invites go out, if you wouldn't mind either like immediately after they go out, forwarding the same email to this group or whoever wants to receive such emails, because I would certainly be on the phone encouraging Title III to be on that. And so I think as representatives of different titles, we can encourage our locals to show up to these things. And sometimes without that encouragement, it doesn't always happen, as we see here. So that would be really helpful. And I would certainly increase Title III's participation.
Okay, great. Thank you. Okay, so yes, we could have done that more thoroughly. But then moving on, just to kind of get to the content of the areas that we were looking at customer-centered design, we were looking at intake and assessment, and we were looking at service goals. Wait, Janice, did you have one more thing that you were?
No, I just forgot to lower my hand.
Okay, sorry, I just wanted to make sure.
Hey, Becky.
Yeah. Oh, I'm sorry. I didn't see you. Yeah. Thank
No,
you.
that's all right.
Justin.
So if we, as a group, as a committee, with Title I, II, III, and IV representation, are going to end up making suggestions on policy changes to these goals, and we have an expectation that local areas are going to respond positively to them in some way, and we think that what happened here is kind of a demonstration of what often happens in local areas, then us as a group, we kind of need to keep that in mind. This is my opinion. The conversation shouldn't be about there is less representation. The conversation should be about how can you spend 3 months doing something and people still don't show up? And so there's something we need to change as a system where we're paying attention and we're making sure we're showing up and we're giving things priority and not being upset after the fact when, 75% of us decided not to show up. So going forward, if we're serious about serving customers and intakes and service goals that local areas care about, there has to be some sort of sense of urgency and accountability where 3 months go by and we don't blame somebody else, but we say, we didn't do this as a local area. We didn't take responsibility for it. And we got to stop that from happening. So from going forward from now on, if something needs action taken, we need to take action instead of not taking action and then complaining that some people didn't show up. And how do we do that? And maybe that's a rhetorical, but I see it all the time as people complain after the fact instead of doing something beforehand. And that is, typical government type stuff. So let's try and not do that and figure out, how to solve the problem before it happens and get everyone to take this seriously, commit to it, be accountable to each other, and not a year from now go, oh, I don't know.
Right. Thanks, Justin. I appreciate that. So the last area is around 4 goals addressing how the one-stop services are provided. And so those were the 3 areas that we talked about. One-stop operators, talk to one-stop operators about. So Sarah, if you want to just keep going here. Again, we asked in each goal area how it's working in the local area, what could be done better. And we're still pulling it together in terms of the themes, but I will say for the first one around customer-centered design, we did hear from the local areas, that they're building back their capacity to gather feedback, and that they find it challenging to build this back when, some partners are in person, some are not. And that seems to be just like a continuous rub around getting this goal. We heard a lot from the partners about how they felt in terms of coordination and communication when things were shutting down through COVID. So that's just kind of a snapshot of the feedback that we received. In terms of the next area, intake and assessment, it's the same thing, but we definitely saw local areas being creative and developing tools. And so we, in addition to sharing out what we've been doing in LWS 7, we're going to do some deeper dives into some local areas that really felt like they had some strong tools in place for intake, assessment, and referrals. And then in the last area, again, we want to uncover more of the creative solutions that LWEAs have been mentioning in the focus groups, and, talking about how, we have really discrete policies around a 7-day turnaround. In our referral, we add contact information, customer receives a copy. So we're going to be doing a little bit more of a deeper dive with a couple of the areas in the next couple of weeks, and continuing to have conversations there. But overall, we saw some bright spots on the landscape. We also heard a lot of, things that Justin has definitely been talking about since I came into this position of leading this work group around trauma and recovery, and, feelings about how to rebuild after going through everything that we've went through with COVID. So from there, if there's any feedback or discussion, as I mentioned at the top, we were also asked to present on the work that we've been doing in LWEA 7. And so I kind of want to be sure that we have time for Stacy's presentation about what the one-stop operator team has pulled together. Many of the new faces that you're seeing on today's call are the one-stop operator team from Scale It that has been on this referral recommendation journey for like a year now, and trying to really be sure to do the due diligence and get that engagement from all of the titles and all of the partners. And so I think from here, I will turn it over to Stacy.
Right. Hi, everyone. I'm the Strategy and Implementation Director at Scale It. We have a lot of the one-stop operator team on the call today, and we're going to go over some slides that we have been sharing with our referral working group. Want to go to the next slide? Yeah, so I'll go over a little overview. I'll show you a timeline of what we've been through over the past year. And then we've recently started to collect some survey results from our partners on what platform they would recommend. Go to the next slide. So we take a human-centered design approach to our working groups, tackling a number of different projects. Referrals is one of the things that we're tasked with to try to bring a unified referral process to LWEA 7, which consists of 10 American Job Centers. And yeah, we ask volunteers from the centers, ideally across all partners and all the offices, to help us figure out solutions. We want to hear directly from them. We want it to come from them. That's the human-centered design aspect. We're creating this for you. So whatever you guys want us to help with, and whatever would work best for the individuals on the ground, that's what we want to bring to the table. Jump to the next slide. So some of the goals of the referral working group specifically includes having the standardized process across all of the network, improving the customer experience, making sure that we're able to do follow-up and reporting around those referrals, and then double checking, that this is a process that works with continuous evaluation and improvement. And then, of course, the one-stop operator will provide training to the centers and all the partners to make sure that we're all using this correctly. Next slide. These are the members that we've had participate over a little under a year. These individuals have attended one or more of the working group meetings that we've had. So we have had 46 partners across 7 titles and 22 organizations. And I think we've had representation from all 10 of the centers in Alwea 7. So go with that. Yes. So we started around February, so almost exactly a whole year ago today. We were tasked to, again, bring a referral solution. Oh, we've missed Tara on there. Got to make sure we add her. So we've had a number of referral working group meetings where we collect feedback and what the partners are looking for. We've had a number of demos of all of the platforms. Partners are able to sit with us in the demo and or view the demo after the fact. We have those recorded and accessible. And then we've done a few pilots, testing some of these platforms out on a small scale. Some of the pilots require a lot of investment to build that out on the front end. So not everything was feasible to pilot, but we kind of did our best to try to test things out, see if they're working, and then kind of lean towards, collect that feedback and lean towards one way or another. And so we did this for several months, and recently in November and December, we asked our partners, now that you've been through this journey with us, can you let us know kind of what is most important to you? Is there a platform that really sticks out as a clear winner, or in your mind, something that would really work for the system? And then in January and February, we are hosting leadership meetings to loop in the key leadership of the core and required partners at the American Job Centers to make sure that we have their buy-in. Everyone really understands what this means for their organization, what this means for their staff, what this means for just service delivery across the board, and how this could potentially change the way that they do work. And then, overall, like what the working group came to the conclusion of. And then our hope is by March, we will have a final recommendation to present to the Workforce Investment Board and the Service Delivery Committee on that board, so that we can get their consensus and their approval kind of to move forward and start build out and implementation of whatever platform we choose. Go ahead. Jump to the next slide. Oh, sorry, this got a little wacky, but these are the platforms we looked at. So we did extensive research on what platforms are out there. We asked areas in Illinois, we asked some areas across the country, what are they using, what seems to work? And so these are the ones that we looked at as a group. So we had Career Connect, that's a local platform that's being used for case management for Title I. Illinois WorkNet, sure everyone's aware of that. It's kind of run by SIU, contracted by DCO. It has a lot of, it has the AJC Service Finder, WIOA policies, professional development opportunities in that system, and it's being used by SNAP ENT. NowPow and Unite Us is another platform we looked at. Google Forms, very, very simple, just notification. This is a referral that we want you to work on. Illinois Job Link is being used by IDES. And we looked at that as an option. RiseKit is also kind of a local provider that does a little case management, but has referral capabilities. My OneFlow, same with that. It's a for-profit company that really focuses on the customer experience and the customer journey. Iris is like a social service network that is also has referral capabilities. At Work Solutions, I think that's based out of Indiana, and it's custom build out, very like a web page almost, that, you know, is very simple. Like, you know, here are the services, here's the referrals. And then Atlas, which is a system that's used across the country, over 80 American job centers, that really has a lot of other tools in there too, but their one-stop operator portal does have a referral piece. Do all of them meet PII guidelines? So yeah, a lot, like all of them will claim that they're under secure networks. And so like that was definitely a question that was asked throughout the working groups. Some of those are a little bit more, like I think it was now Unite Us or Now POW Iris is HIPAA level PII. And then there's some that have, you know, security, like, you know, Google, but it's a little bit on the lower end. So we try not to share, you know, super sensitive information from there. So that was something we looked at. Yeah. Okay, I want to jump to the next one. So based on our partners, here are the features that they found most important. They want to make sure that this referral platform is accessible to all partners. It allows for us to have email notifications when you get a referral, when you receive a referral, or when you send a referral. They all need to have reporting functionality or a dashboard and outcome sharing. Ideally, you would have some message system that you can use to communicate. Ability to schedule appointments was something that I think we ended up moving to the nice to haves, but it was originally something that they wanted. A common intake and release form was important, and then having the ability to upload files. Some of the other things that we looked at that were nice to have, but not necessarily deal breakers, is that the customer can start the referral process. You would have the ability to text or blast out notifications to customers. We would love to have calendar capabilities so that we can be on the same page with events coming up and be able to communicate those events. Same thing with resource newsletter and connecting to jobs. So these are, you know, things that came from the partners that we did an analysis on each of the platforms, like how well do the platforms meet these features, this wish list. We also looked at costs, timeline, and is this something we can grow with? Under must-haves, so we can add PII as one of those must-haves there. And yeah, we do want to scale with this platform. Absolutely, Tracy or Kathy. Okay, next, referral systems. Yeah, so we just started to collect surveys from our partners, asking them which systems do they recommend, and we got a pretty good spread across the whole network. However, we did not get that many submissions, so we didn't have that many people vote on what platform is most important to them. We would like to see a little bit of a bigger turnout. Okay, I'm gonna jump to the next one. So what is coming up as number one so far, and as we only collected about 12 responses, is Illinois WorkNet. And a lot of what we're hearing is a lot of people really like that because they're already using this as a system, and this wouldn't add to the number of platforms that they have to get into every day for their job. So that was high on the list. However, I do want to, be transparent with the fact that when we started to collect those 12 votes, 12 responses, we didn't have what it would cost to maintain that website on an annual basis. So if we were just to contract with Illinois WorkNet directly to build out a referral portal and use that for LWIA 7, the cost would be about comparable to the other options like Atlas and Workforce Solutions. With that in mind, I know that many of the people who did voice their opinion, they liked Illinois WorkNet because they thought there was going to be free or very, very low cost because it's a state system that we're already using. But that is not necessarily the case unless DCEO would alter their existing agreement to include referrals in there. So that is something that I would want to take another look at with the partners and say, like, so if Illinois WorkNet was the same cost year after year, and we would have to potentially do some type of cost sharing to pay for that, would that change your vote at all? So that's something that I just want to throw out that caveat that is not something we really understood when we got started. It was more of an assumption that it would be much, much lower cost and or free on an annual basis after we do the initial build out. So just wanted to throw that out there. Coming in second place was Atlas and Workforce Solutions. But again, I feel like this is a small, we did not get many responses. Yeah, so wanna go to the next slide here. So this just gives you some idea of everyone's top, their first choice, second choice, third choice, and those that would not recommend across the board.
Were the systems comparable in cost from what you saw and what you knew?
Yeah, the ones that made the top three were, whether it's a little bit heavier on the initial build out or a little bit heavier on the end, Atlas and Illinois WorkNet were very similar in cost. At Work Solutions was actually very, it was less expensive, surprisingly.
Cool. Thank you.
Yeah, I think I don't know if we have a slide that has those numbers, but we do have it in our full deck, which we want to, invite everyone to look at. And then if you are available, we have these leadership meetings where everyone is welcome to sit in, and really we're going to go in depth into the analysis of each platform and what the results are showing. I can go to the next slide so we can show kind of what the partners feel are most important. And again, this is only out of our 12 respondents. The fact that it has all of the wish list features was number one on the list. Being able to easily navigate and it being very user-friendly, or having it available on mobile was the second one. The cost was coming in on the third one, even though when we were listening in the work group and talking amongst ourselves, that did come up quite a bit, especially coming from some of the state agencies kind of, wanting to be very conservative with making sure that we're not committing to, a $10,000 annual amount that they would have to pay a portion of every year. And then integration with other systems, all the additional features that would be really nice to grow with. And then the time frame, as you can imagine, is towards the end, since we have been operating with that one for quite some time. Okay, I'm gonna jump to the next slide. I'm not sure. So this gives a little bit more of an overview as to what each of the top three systems pros and cons are. I think, I don't know if there's anything I want to call out specifically.
Does WorkNet have the texting capability?
It does not.
Okay. Oh, that must be one of the nice to haves then, right?
Yeah,
Okay, thank you.
it's one of the nice to haves. But it does have an existing API agreement in place to share some information with another one of our titles, which Atlas and Workforce Solutions, we would be starting from scratch there.
Yeah,
And-
Stacy.
Yeah, Tara, go ahead.
No, I was going to say, I think that was one of the appealing things that most people were talking about with Illinois WorkNet, being able to share data with, IDHS or some of the state organizations. So
Yeah.
might be easier through Illinois WorkNet.
Yes, and the fact that they are somewhat already familiar with that system came up a lot. Yeah. Yeah, I think that there's one more slide that just continues on with pros and cons. Yeah, so we would have to build out that Illinois WorkNet system, even though there are some people in the state with the SNAP ENT program who are already using that as a referral, using that referral piece in Illinois WorkNet. Yeah, Carrie, do you want to say anything?
Two questions. The first one is just sort of technical about the survey. So you said you had 12 responses so far, is that correct?
I think so. Yeah.
And a couple of times you've mentioned people wanting to use a system they're familiar with or don't have to duplicate to another system. So do you know the respondents, those 12 respondents, by which title they work in?
We definitely can look at that on the back end. Yes.
I think that would be interesting if you get more, just to see if there's a difference. And then my second question is more like sustainability, sort of higher level. So is the idea that you'll pick a referral system and then it will become like the mandatory system that every partner in that AJC has to use, and it'll be like, that will be, I don't know, like all written out, like that'll be part of the MOU agreement, and like both the use of it and all the policies around using it and when to use it and information sharing and all of that would be part of that MOU process, and cost sharing, if that was that, is that correct?
That is the hope. So the partnership did commit to paying for the build out of whatever program we initially choose, and then building in the maintenance of that with the OSO as the lead to make sure that the proper training is being used, that the proper training is being given, and that the system is being used by the monthly partner meetings that we have, and constantly, bringing this up as the tool that all the partners in LWIA 7 are committed to.
Okay, thanks. And so then, oh yeah, thanks, that's fine. Thanks, that's helpful. Thank you.
Yeah, so this is what we've been doing for the past year, trying to narrow it down to what platforms make sense, what do the partners want, and then now we're at the point to bring in everyone who was not in those working group meetings, all the leaders that we really need for them to get on board, with us in this build out and implementation of an actual referral platform finally.
Yes, Janice.
Yes.
Right, when can we expect the invitations for that leadership meeting?
So I believe those went out early in this year, and if you haven't got one, we can forward them out. We have 4 meetings coming up, 2 remaining in January and then 2 in February. So there's still time to look over the materials. We even give recordings of the demo if that's something that you're interested in, and then attend those leadership meetings so that we can really talk about what this means, and kind of having some asks to have you with us on this journey. Oh, hold on.
I just wanted to say thank you for sharing. This is really cool. I'm eager to see how this goes and where it goes, because this could be a game changer.
Are there any thoughts about, Illinois WorkNet as a platform, since that seems to be the lead contender at the moment?
Hi, this is,
Sorry, Amy.
no, I just had one question about scalability. So a lot of this has been done for LWIA 7. Are there questions on the survey, or is there an opportunity to discuss scalability? Like for WorkNet, would that be for the whole state, or would that just be for LWIA 7? I mean, we would want the whole state to be.
Absolutely.
Yeah, I would love that too. If we can get everyone across the state on one platform. When we sent out emails for the leadership committee, we got a request from Julio to see if he, to meet with us and talk about that. So that was really, really exciting.
I can speak a little bit about the Illinois WorkNet.
Since
This is Natasha with Illinois WorkNet. We do have, excuse me, been having trouble with my voice all day. We have, we use the referral piece already with our SNAP ENT partners, and we've used it in past projects. So we do have it in place for certain programs based on the business requirements for that program, but it's something that, once we have in place and have business requirements for, we could easily do it across the state. We're already doing it, but it's, very specific for various programs.
We would have to do a full new build out for the AJC partners for referrals.
Well, yes. And I mean, it's really not a full new build out. It's taking our existing tools and putting it in a space that it would be used by those specific partners and managed by those partners. But it would take developer time to set up that space.
Thanks, Natasha. Laura, did you have your hand up and then you took it down? I just want to make sure you have time if you had something you wanted to mention.
I did have it up and I took it down because Natasha responded. I was aware that they were also using the referral section under the JTED program, which is a state workforce program. So I do know that they have developed that for the JTED program as well. So
yeah. Yes. So we have it developed out so that we have, like, within the SNAP program, it's more of like both partners are both in the system. So it's, internal back and forth between those partners. For the JTED program, we expanded it out so that they can send referrals. Like, for example, a JTED grantee would be in the system and they can send out a referral in a secure way to a partner that does not require them to log into Illinois WorkNet.
Okay, great. Thank you. Thank you, Stacy. Thank you, Natasha, for joining. I think that referrals are an important part of the service integration, and that but Sarah and Drew keep reminding me that the policy recommendations don't have to be super specific. And in fact, we probably wouldn't want to rewrite the policy to be as specific to Illinois WorkNet, because in the focus groups, we heard from some LWIAs that, a couple of them feel like they have a really solid thing in place with referrals. And so I think, we probably just want to make it as a recommendation that there is something in place, because we know that a lot of LWIAs don't have necessarily anything in place for referrals. So, yeah, go ahead, Kathy.
As another piece to be thinking as far as forward thinking, moving beyond the referral, some of the conversations happening at the state level are talking about referral outcomes. So more than referring a client to another title or service, it has to be thinking forward of being able to track that co-enrollment in titles, co-enrollment in services. Was that service picked up? Did that student client receive services from that other title that was referred to? So as you're looking at the referrals, also to be aware that the conversations at the state level are also looking at referral outcomes and thinking about how that is tracked in these processes as well. Because we're moving beyond the time when we can just say, I referred a student from Title II to Title I, and not being able to know if that student got that service picked up. So some of that tracking is going to become part of where we could be moving. And I don't want to speak for all the titles. I'm simply saying that these are conversations that are happening at the state level, and to be aware as you move forward with these work group discussions on referrals, to be thinking about how are you going to track the referral outcomes. And do these systems allow for that? Because that is definitely a conversation that's happening.
So the referral outcomes piece was a must-to-have feature, and all the platforms meet that.
Mhm. Yeah.
Yeah.
And that's just, you know, like I said, as you lay this out, that is one of the things to make sure we need to be able to integrate in a meaningful way. And also in those outcomes, I don't know what these systems have, but also thinking about if a person was, for my lack of a better word, denied a referral. I have a student, I send the student over to another title, and the other title says, no, we're not going to support this student, and here's the why. And there's a rational reason and a logical reason, but that needs to be documented as to why an individual was, for my lack of a better word in this conversation, denied services. That needs to be part of it as well.
Yes. Okay, I'm wanting to be sure that we end on time here. And so the next point is around a policy writing subgroup invitation. Sarah, I don't know if you want to say.
Are we ready to write policy? Because I don't know that we're ready for that step. Are we?
What would you like to do? I mean, this is just asking a subgroup to come together. I think that's how some of the other working groups have done.
Oh, I didn't realize we were at a point where we were ready to start putting policy on paper. I didn't think we were at that point yet, but it sounds like the members of this committee feel like we're at a point that we can start writing policy.
Mhm.
What do other committee members think?
I guess I had the same reaction as Kathy. I mean, maybe I'm just not hearing conclusive things that we've
Yeah.
done. So.
Right. And I would say I have to kind of agree. If you're wanting a policy writing subgroup, what are the tasks that you're going to give to that subgroup? What places in the policy do you feel that they should tackle, and with what information that we have gathered during these preliminary meetings are we going to use as a means to do that?
Well, we have 3 areas of the policy that we're focused on, and the other areas are being addressed in other work groups. And we are still pulling out the themes from the focus groups and also looking at the local plans. So maybe this was too soon to put the invitation out, and we can report out in February in more detail about the plans and about the work groups. And we can ask for for the policy writing subgroup, we can do that next time.
So I apologize, to clarify, I just read in the chat that the PowerPoint from the meeting with the focus group results will be shared after the meeting. So as I'm looking at this, what I interpreted, and again, just for clarity, that we had the focus groups and then you had the representation from Title I and Title III. To some points made earlier, it does not appear from these conversations that we had full participation from all the partners. So, okay, I see what she's saying now. This PowerPoint, okay.
think
Will
Molly's
this
just saying-
committee have the results from the focus groups that you've conducted, or is that something you're still working on then?
Yeah, we have the notes. We can share out the notes.
Okay.
Mhm.
And is there a step that we can take, and I'm more than happy to do the work if you want me to do this, to bring in the other titles to give them a voice at the table. I'll be more than happy to step up and do the work. But I do think that we can't get to a point of policy writing until everyone's at the table. So if you, I'm again, more than happy to step in. If you give me the guidance and the questions and the direction you want that to go, I'll be more than happy to step in and do that work. Or assist somebody with that if they would choose to do so. But I don't know that we can get to a point of actually writing policy without all the title voices at the table. Recognizing that that's what you were going for when you started. I know that's what we're looking at, but how can I assist you with this?
Yeah, I mean, I'm sure there were a lot of Title II individuals on the invitation. We can go back and look at who the invitation went out to and figure out like how we could set up another time to have a focus group with them, you know, how we did hear back from
And we can work
one.
offline if you want me to do this. I'll be more than happy to follow your lead on this offline. So we don't have to drag everyone in that conversation, but I'm more than happy if I'm going to ask you to make sure we have those voices at the table, then I will absolutely step up and do the work to make sure we have those voices there. So if you just tell me what you need me to do, I'll do it.
Okay, that sounds great. Okay. So we'll come back with more detail at February's meeting and move on from there. Thanks, everybody.
Thank you.
Bye.
Bye.
Thank you.
Bye.